Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Darga Saheb, interventional cardiologist, KIMS Hospitals, Nellore. And today we are delving into a silent epidemic that India is combating, that is heart failure. So, heart failure is a very dreadful disease where the early diagnosis and treatment gives a very good quality of life to the people. But a neglected in the diagnosis and treatment, it causes more mortality. So, especially in Indians, the majority of the people affected are a very young individuals, whereas in the Western countries, almost they are elderly people. So, why our India is facing this problem in the elderly individuals? So, because the genetics they play a very significant role. So, Indians are genetically more vulnerable to cardiovascular diseases, and further the other comorbid conditions like diabetes, hypertension, obesity, and smoking, they are more in the Indians and they worsen this epidemic. So, what are our symptoms or signs or when we call it as a heart failure? So, first of all, when the people gets a diagnosis of heart failure, they think that it is the end of their life. So, their life has gone. So they are useless. So they can't do anything in their life. But it is not true. So the heart failure means it is also one of the cardiovascular disease. That is one of the heart problem where we can improve our quality of life by taking a proper treatment. So what is heart failure? Heart failure is failing of the heart to pump its blood. It is measured as ejection fraction. It means how well your heart pumps blood. So it is the amount of blood pumped out of your heart's lower chambers, that is ventricles, each time it contracts. So when it contracts, so certain amount of blood should come out of the left ventricle so that it gives some value. It is called ejection fraction. So the normal ejection fraction is approximately above 60%. So 50 to 60%, it is a low range ejection fraction. So 40 to 50%, mid-range ejection fraction. Less than 40%, it is a severe decreased ejection fraction. Next one is what are the signs and symptoms of heart failure? So how can we recognize the patient has developed heart failure? So the most and foremost important point is shortness of breath. That is, patient develops more difficulty in breathing during the daily activities, during walking or doing a short activity. Next one is fatigability. That is easy fatigability or heart palpitations. That is increase in the heartbeat, increase in the pulse rate upon a small activity. Confusion, and there is a generalized weakness, that is we call it the malaise. So there is also loss of appetite or vomiting. So these are the various manifestations. Sometimes they develop pedal edema, that is limb edema. So both lower limbs are affected. Sometimes there is also facial puffiness also there. So then how can you protect ourselves from this disease? So our heart works incredibly hard to keep us alive. So these are the 5 golden rules we can follow to return the favor. One is early detection of heart failure through regular blood tests. So I have told you very early. So early detection and early taking the proper treatment can cure us from the heart failure symptoms. Next one is dietary adjustments to maintain heart health. So taking less oily food, less salt food, and having a good physical activity, that is incorporating daily exercise into your routine, is very very important. Next one is practicing stress management techniques. So stress reliever, so decreasing our stress is one of the important factor to decrease our catecholamine load, to decrease our adrenaline rush into the body, which has a worstful effect on the heart. Quitting alcohol, tobacco, and smoking. That is the bad habits which are very well explained in every mode of our healthy life. That is avoiding of this smoking, tobacco products, or alcohol is important. Then lastly, what comes next after a heart failure diagnosis. So, if we are diagnosed with heart failure, then how can we treat it? That is the another important question. So, thankfully, the medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. So, heart failure medications, especially the beta blockers, angiotensin receptor blockers, or angiotensin converting enzyme inhibitors, or spironolactone, that is the mineralocorticoid antagonist. So, these are all the drugs, that is the diuretics, also helps in the proper management of heart failure. And some devices came into role like biventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement. These are the various device therapies. And a last resort, the treatment option is heart transplant. So if the heart fails, even after giving the medical management, that is various drugs, and after the device therapy also, the last option is heart transplant. So the lifetime risk for congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures, they are key in combating the silent epidemic. Thank you.